All right, well, let's begin. Again, good morning, good afternoon, and good evening to everyone. Thank you for joining the Faith and Public Integrity Network for our final webinar of the year. The speaker for our webinar today is Marius Ungureanu, who will speak on corruption and anti-corruption in healthcare. Why do we speak so little about them? Currently, Marius is the director at the Center for Health Workforce Research and Policy at Babeș-Bolyai University in Romania. This webinar will address root causes of corruption in healthcare, as well as potential solutions for both individuals and organizations. At the end, there will be a time for questions and answers. Just a few details before we begin. As you can see, you are all on mute right now. And we ask that you remain on mute as we listen to our speaker. As I mentioned, there will be a time to ask questions at the end, so you are free to unmute yourselves then if you would like to ask a question. Please feel free as well to use the chat to introduce yourselves and write down questions to be answered at the end. If you need technical assistance, please send me a message through the chat. So my name is Allison Bassett. I am the FPIN administrator and I'm supporting this webinar. And with that, I will hand it over to Marius to begin his presentation.
Thank you, Allison. Thank you for the invitation and thank you for your kind introduction. I will now share my presentation with you in just a minute. And I suppose you can see it now. Okay, thanks so much, and thank you to all those of you who decided to take some of your time to attend this discussion. It is my hope that this will be an interesting discussion. As Allison mentioned, there will be time for discussion, for question and answers, and I'm looking forward to hearing your views on the topic and your experiences. My aim is to present for maybe 20-25 minutes so that we have enough time for discussion. As Allison already mentioned, I titled my presentation Corruption and Anti-Corruption in Healthcare. Why do we speak so little about them? And I don't want to jump to conclusions too easily, but what I will try to demonstrate is that the very simple and straightforward response to why do we speak so little about corruption and anti-corruption in healthcare is that because it is really difficult to do otherwise. And to that end, what I aim to do in my presentation is to briefly discuss about the root causes of corruption in healthcare. What can we do in terms of anti-corruption approaches, and also a little bit on the role of faith in addressing corruption in healthcare. But before going on with my presentation, I'd like to take you a little bit back in time in Romania. It was the year of 2015. It was the end of October. I remember it very vividly. A tragic event happened in one of the clubs in Bucharest. A wildfire erupted, and what eventually it led to was a couple of tens of people being killed by the fire, either immediately or in the next few hours. Eventually, the total death toll was 64 people who have died after that fire, either immediately or even a couple of months after that fire. Why do I choose to present you this example is because what the authorities have found out after the fire. It turned out that that party was taking part in a club which did not have all of the permits. As a matter of fact, they were lacking most of the permits from the city council for them to function. What that led to is that when the fire broke, people were not able to exit that building, and so basically they were sure victims to the fire. What the authorities have found out really soon was that the owners of the club had bribed authorities in order to get false permits for them to function. What that has led to was a vivid reaction from the population, and what you see on the slide is just a photo from a huge protest which took place immediately after the fire in the collective club in Bucharest at the end of October 2015. There were tens of thousands of people on the streets of Bucharest, but not only Bucharest, the capital city of Romania, where the fire took place, but also on the streets of other cities in Romania. What they were protesting against was the corruption, the generalized corruption that was taking place in Romania, and particularly the role that corruption had in the events which led to the fire in the collective club. And it was that moment at the end of 2015 when one of the most important slogans of the recent years in Romania appeared. And you can see it here. This is a picture taken on the doorsteps of the club where the fire took place. And it says in Romanian, "Corupția ucide." That is to say, corruption kills. And maybe we can think of it figuratively, but in the case of the collective fire, it was very not figuratively, because basically the corruption that allowed for the club to function, which led to the death of so many people, and most of them were really young people, was corruption. But that was not all. Many of the people who survived the fire died in hospitals, died in Romanian hospitals, because they were infected with healthcare-associated infection, nosocomial infections. What authorities discovered after that was that one of the companies which has been providing disinfectants for hospitals had been diluting these disinfectants sometimes even 2,000 times. So basically what they were selling as disinfectants was just water. So they did not have any effect. And so I wanted to share this with you to introduce you to the topic, and to share the experience that we've had in Romania with corruption. And we might say that this is a big scale corruption, which is systemic and maybe more difficult to address. But as a matter of fact, there are many types of corruption in healthcare, and I don't want to insist very much. I don't want to be very didactic. I already assume that many of you are familiar with these issues. The Transparency International, in a report published in 2019, listed a number of types of corruption in healthcare, from absenteeism, informal payments from patients, theft and embezzlement, service provision, favoritism, manipulation of data. These are all types of corruption. So this is the same phenomenon under various forms. We in Romania, as a former communist country, have unfortunately inherited many of the background elements which favored corruption in the healthcare system. Absenteeism is one of the things that we are facing with. Many times in the scientific literature, it is proven that especially in healthcare systems with a dual practice, absenteeism tends to happen quite frequently. Informal healthcare payments is something which the Romanian healthcare system is currently still dealing with, as are a number of other countries in Central and Eastern European region, but also in Central Asia, to speak of the neighboring area, but in many other parts of the world, informal healthcare payments, those payments made by patients or their relatives directly or indirectly to healthcare professionals in order to either have more rapid access to services or to have access to better quality services. Theft and embezzlement, we're seeing, we've had in Romania many cases in recent years of hospital managers who have been sentenced to jail because when they were doing procurement, they were soliciting companies in order to declare them successful for the procurement procedures. They were requesting them to provide to managers 10% or even 20% of the contracts or various percentages of the contracts. So these are maybe more systemic aspects, but also favoritism, so favorizing various categories or individuals for health services. That also accounts of corruption, and of course manipulation of data, so falsifying claims in order to get higher revenues or to favor specific providers. In 2000, I guess it was 2017, we had one of the most recent cases when the director at that time of the National Health Insurance House, which is an institution which is managing the second largest budget of healthcare, second largest budget in Romania, has been sent to jail because he has been manipulating claims from home care providers based on fake claims. And in the same time, the media has been documenting that people in real need of home care were dying in expecting to have access to these services. So the natural question which appears is what do we do in front of these multifaceted elements of corruption in healthcare? How do health systems respond? How do we as professionals, how do we as groups respond to corruption in healthcare? And the reality is that we do not speak enough about corruption, and we unfortunately do not do enough with regards to corruption in health systems. And in 2019, a group of people, and I'm sure that some of you know at least some of the authors, Professor McKee at the London School of Hygiene and Tropical Medicine. There was this editorial written by Hutchinson, Balabanova, and McKee in the International Journal of Health Policy and Management, very suggestively titled, "We need to talk more about corruption in health systems." And what the authors do is, first of all, to make an inventory of why we are not talking enough about corruption in health systems. And I was just mentioning at the beginning that the reason for which we do not speak enough about corruption and anti-corruption in healthcare is that because these are very sensitive topics and very difficult issues to address. Among the reasons that McKee and the team identify is the fact that many times there are difficulties with defining corruption. And I have to say that I'm a researcher. I'm teaching and I'm a researcher, as Alison mentioned. And for a number of years, I've worked on informal healthcare payments. And there's an entire, if you are working as a researcher in this area, you might know that we call them informal payments, not necessarily bribes or under the table payments, because informal payments has a more neutral tone for them. Because in fact, it is very difficult at times to characterize payments as being bribes or under the table payments. So the difficulties with defining what is corrupt and what is not, because there are so many blurry lines between them, is one of the reasons for which we speak too little about corruption. Apart from that, there are some forms of corruption which might give to one impression that they keep the system working. And I can give you a very practical example from Romania. You might know that Romania is one of the countries from where many health professionals used to emigrate and are still emigrating to other countries, generally from Western Europe. But what we discovered during our research project on informal healthcare payments, we discovered that, in fact, informal healthcare payments, despite the fact that they're a form of corruption, have contributed to a certain extent to keeping a part of the healthcare professionals in the country. Because at a time when salaries in the Romanian healthcare system were really low, informal healthcare payments have been a source of extra revenue for healthcare professionals and an additional incentive for them to stay in the country. Another reason is that it's very difficult to engage in anti-corruption research, and I've experienced that firsthand. First of all, because many times this is a taboo topic. Many times people are reluctant to speak about that. And I remember when we conducted interviews and focus groups with healthcare professionals on the topic of informal healthcare payments, we came to the conclusion that when we analyzed the results that we have a strong bias, because the huge majority, if not all, of the healthcare professionals who took part in our interviews were strongly opposing informal healthcare payments. And when we analyzed the socio-demographic, we discovered that it's mainly rather younger professionals who have not been that exposed to this phenomenon, whereas other people have refused. So if we were only to look at the cohorts that we have been working with, that would have meant that there are no informal healthcare payments in the Romanian healthcare system, and that every one of the healthcare professionals were strongly opposing them. So clearly there was a selection, self-selection bias in that process. On the other hand, many times in our healthcare systems, when we try to discuss about that or to tackle that, there's always this perspective that there are more important issues than corruption. And I've experienced that firsthand, and it's very difficult to try to place on the agenda a topic that many people are arguing against. Last but not least, and that is maybe one of the results of the fact that we discuss so little about corruption is and have such a small amount of research on corruption and anti-corruption in healthcare. The natural result of that is that we don't have strong empirical evidence with regards to what works and what does not work in terms of reducing corruption. So what can we still do about that? In the same report that Transparency International has been publishing in 2019, there are a couple of directions that they're suggesting, such as strengthening top-down control, strengthening bottom-up accountability, and strengthening staff morale and motivation. So what I take from here is that, and it is that relates to my experience as well, is that corruption in healthcare cannot be addressed through a single means. And it's not enough to look at a top-down approach. It needs to be complemented by a bottom-up approach where we need to empower individual patients and also invest in community monitoring. Although, to be honest, the results of the research are quite mixed in terms of the effectiveness of these approaches. Nonetheless, another important area that we need to address is strengthening staff morale and motivation. What we see, according to evidence, is that many times it is low staff morale and motivation, it is low payment, low wages, poor opportunities that expose them to this temptation of accepting bribes or being involved in theft and embezzlement. There are also a couple of areas that McKee and colleagues are suggesting as a result of the fact that we do not speak about enough about corruption in healthcare and anti-corruption. And there are three main suggestions. First of all, to seek an agreement on the scale and nature of corruption in each health system. As I have been presenting earlier on, there are many forms that corruption can take, and they vary from a context to another. And many times what works in one context would not necessarily work in another context. The second point is to prioritize actions. So there are many times quick wins, low-hanging fruits, and in the same time there are areas which cannot be addressed immediately. And last but not least, they suggest providing a holistic view of corruption and anti-corruption as a public health issue. Because if we address corruption as a public health issue, then we need to engage with a series of areas of domains like anthropology, law, economics, in order to not only identify ways in which we can fight corruption in healthcare, but also how we can prevent corruption from happening in the healthcare sector. And how should we respond as Christians to corruption in healthcare? And I believe this is one of the difficult questions that we might be facing when we are placed in the face of injustice and corruption in healthcare. And I have to admit that it has been a struggle for me as well. I'm trained as a medical doctor, and during the residency training that I have pursued, there were moments when it was very difficult to either have a healthy approach to situations when I have been close to corruption, or to contemplate from the exterior what was happening in the system. I guess what we need to agree is that the Bible is telling us clearly that God does not accept behaviors associated to corruption. And we see in many verses in Deuteronomy and Isaiah, God is a God of gods and lords of lords, the great God, mighty and awesome, who shows no partiality and accepts no bribes. A bribe corrupts the heart, and in Deuteronomy 16, do not accept a bribe, for a bribe blinds the eyes of the wise. And I believe that what we are called to is to just make sure that it is the type of people that God wants in leadership positions whenever we might get access to those positions. But otherwise, I believe that whereas some people might be called in leadership positions and are called to be strong voices against corruption and to speak publicly about that, I believe there's also a mandate for each one of us individually to express integrity and to reflect God in our workplace. And one of the reasons, one of the ways in which we can do that, and that I have experienced firsthand, is meeting with fellow Christians who share the same values and the same worldviews. And I know for sure that during my years as a student, and then as a junior doctor, and then as a professional, one of the things that I appreciated the most was meeting with fellow Christians working in the healthcare sector and being able to share the struggles that we're having, and how we can pray for one another and support each other in order to represent God where He has placed us. Now, I will get slightly to a close, but what I wanted to follow up with is that I have mentioned that at the end of 2015, there were these huge street protests. And the result of that was that the government has been forced to step down. That was a requirement from the people protesting on the streets, tens of thousands of people. And the Prime Minister and the team of ministers eventually stepped down. And it was the requirement of the people protesting that the president will appoint a technocratic government. And that did happen. And as of November 2015, we had in Romania a technocratic government. Now, of course, the challenge was great for the entire government, but especially for the health minister, who was to manage all of the complicated situations that have just been surfaced by this unfortunate event. And the health minister, who has been appointed at the end of in November 2015, unfortunately was not able to address all these very complicated challenges. And so he has been forced to resign in May 2016. And it was then when another minister has been appointed. He was just 33 years old, a Romanian who has left when he was very young to study in Vienna, and in the years preceding 2015 has been helping children suffering from cancer to have access to medicines which were not available in Romania. And so mid-May 2016, this new young minister has been appointed with a very brave agenda to fight corruption and to speak about corruption in the Romanian healthcare system. Now, it was then when I was working as a researcher at that time in the university, and one day I got a call from someone whose number I did not have on my agenda, and he introduced himself as the Minister of Health to be appointed, and he asked me to join his team of advisors, and which I did. And for the period of from May 2016 to August 2016, I served as an advisor to the health minister, who started the effort to take the anti-corruption fight in the Romanian healthcare system at another level. His name is Vlad Voiculescu, and you see it here in the on this announcement, which is the title of a movie, a documentary who is presenting the situation which started in October 2015, but is following the subject in the following years. If you're interested in this, I strongly encourage you to look at it. So you would expect that things would have turned in a way more positively, and the anti-corruption fight in Romania would have taken a new, stronger force. We had elections at the end of 2016, just 1 year after people were protesting on the streets for the party which was governing to step down from governing. And fast forward 1 year after, we had elections, and it was the same exact party which won elections that has been forced to step down at the end of 2016. And one of the first things that the same party has done was to push for a strong agenda where they would relax the measures aimed at fighting corruption, which led to other street protests. There were, in one single evening, 600,000 Romanians on the streets expressing resistance, and this is one of the pictures taken in front of the Parliament building. That is the government building, and this is one of the nights when there were 300,000 people here in this image, and then an additional 300,000 people across the country. What does it mean? It means that this just proves the point that I'm mentioning at the beginning. It is not easy to speak about corruption. It is not easy to speak about anti-corruption, and efforts towards anti-corruption in the healthcare sector, or broadly at the national level, at the governmental level, are not irreversible. So they can be reversed at any time. And that is why, as I was been mentioning, based on the report from Transparency International, we can only succeed at that if we have a strong top-down approach and bottom-up accountability. And I would like to get to a close and to just present you a couple of lines that a lady, Patricia Garcia, who's a former health minister, I guess in Chile, if I'm not mistaken, but I'm not 100% sure, which has been published in the Lancet. quite recently. I guess it was 2 or 3 years ago. And it says like this: from my personal point of view, individual acts of corruption at the level of the day-to-day interactions of patients with health services and providers can look small in scale, but they represent millions of negative interactions and have an enormous and damaging effect on our efforts to improve health. They are also more difficult to address than corruption occurring at a higher level. Additionally, these acts become normalized in society and are considered to be just the way things work. And I liked this excerpt from the article published in The Lancet, because in the end, it doesn't really matter whether we speak about small-scale corruption or big-scale corruption. Corruption, unfortunately, has the power to undermine equity in health systems, to undermine access to quality health services, to undermine, in the end, universal health coverage, which is an effort that all of our systems want to achieve in the end. So that is to say that, as I've been mentioning, even though maybe not all of us are called to work or corruption research or to stand publicly against corruption, I guess it is a call at an individual level that each one of us, wherever we are working in the healthcare system or in public administration, or wherever people have access with the healthcare system, to be diligent with the calling that we've given, and to in a way try to counteract this tendency for these millions of negative interactions to transform people's ideas of the healthcare system and healthcare services. And so that being said, I'd like to thank you for your attention. It's 3:36 Romanian time. It's 1:36, I guess, in the UK. As I mentioned, I'd really like to engage in a discussion with you, to hear your perspectives, to hear your thoughts on what we can do better in order to, first of all, speak more about corruption and anti-corruption in healthcare, and not only speak more, but speak more effectively and begin to take actions, because this is this is what it is all about in the end. Thank you so much, and looking forward to the following discussion.
Thank you very much, Marius, for sharing about your expertise in this topic with us, what you have learned from your work and your research in this. As Marius mentioned, now is a time for questions and answers, so please feel free to go ahead and ask questions. You are also free to write your questions in the chat, and we can make sure to address those. So please go ahead, and remember, you can unmute yourselves if you would like to ask a question, and that is on the bottom left-hand corner of your screen.
Thank you, Martin, for your information. Apologies, it was not Chile, it was Peru. Patricia Garcia was health minister in Peru. Thank you for that.
Yeah, thank you very much, Marius. It's something I observe also in so many countries. And you mentioned yourself that one of the issues, of course, is salary level, which is not only in the health sector, but in the education sector and all the other sectors. So maybe one question would be what you see in that respect in order to overcome corruption in the health issue. But before you answer, maybe I share also an experience. In Ghana, I have seen a system developed by an innovative entrepreneur, a simple, not so simple software where people can report irregularities, for example, these informal payments, via an app. when they visit the hospital, when they are asked to do payment before being able to enter the hospital and so on, to report that to an app. And then when they are from the same hospital, a number of messages per week or per day or whatever, it flags yellow or probably red. And when it flags higher, then the center of this NGO goes and contacts the hospital. So it's an interesting citizens observatory system, so to say.
Alessandro, may I quickly respond to that? Thank you, Christoph. As a matter of fact, we have something similar in Romania. For the period in which I worked in government in 2016, because I was an advisor initially to the minister and then served as a deputy minister for a couple of months until the elections. Although I'm not politically involved, as I mentioned, this was a technocratic government. We have implemented a system, it's called the patient's feedback mechanism, where patients, when they get admitted to any type of healthcare facility, they are being asked whether they accept to give their phone number to be then contacted anonymously to provide feedback on their interaction with the healthcare facility. And we developed 10 questions, and 2 of them are related to informal payments. One is whether they have provided any kind of resources, because it's not only money, but in-kind resources to the healthcare facility. And second, if they have been conditioned for health services depending on those informal payments. What I have to say in my experience is that it works as long as the leadership, either in the ministry or in the government, is concerned with that specific fact. Because what happened is that after 2017, when the minister's team left the ministry, of course, there was legislation for which this has been introduced and it cannot be reverted. But instead, the ministry is still collecting, but is not analyzing the data and also not taking any kinds of actions. And also, I guess I spotted something, and I want to link that to something else that I've seen in chat, and what you already mentioned with regards to salaries. What I'm working right now with a colleague who's a health economist to look at the set of data from 2017 to 2020 to see whether we see any link between the level of reported cases of informal payments and the increases in doctors and nurses' salaries. Because what we've had in 2018, we've had significant increases in doctors and nurses' salaries, sometimes up to 100%. However, according to our preliminary analysis of data, there was no link between the increase in salaries and the decrease in informal payments. Informal payments tend to be at the same level consistently from 2017 to 2020. We stopped at 2020 because of the pandemic and because the number of admissions plummeted, basically. So we have, based on the data that we have preliminarily analyzed, there's no sign that informal payments have decreased because of salary increases. And that is just to reflect the multifaceted nature of informal payments, because there are social, cultural factors involved. There's also the patient's mindset. I have discussed, and this is just anecdotal information, I have discussed with acquaintances saying that they felt that if the health professional refused an informal payment that they have met, that has meant either that their condition is so grave that nothing can be done, or that they're just disrespecting them. So it's a vicious cycle that is very difficult to break with one type of measure. Over.
Roberto, I see you.
I think I'll jump in. I was waiting for Alison's sign. Marius, excellent presentation. Really appreciate the presentation. Very well done. Just a very side comment on the salaries. You probably are familiar that there are empirical studies in other countries where they show no connection between salary increase and lowering of corruption. Of course, it all depends on the context, but there are several of those. My question sort of raises a bit the issue of collective action. You're probably very familiar with Alina Mungiu-Pipidi, a Romanian who has studied this issue quite a bit. And I'm wondering, in your analysis, your experience, how does collective action factor into, devising remedies against corruption? When you have a population that sort of senses that this is inevitable, that everyone is, part of this system, and there is no gain in breaking out of the system. You don't want to be the loser. What's your analysis there? What's your experience? And how do you think the church can intervene?
Yeah, thanks so much for the question, Roberto. That's a great point. And yes, I do not have any empirical or very strong scientific evidence on collective action against corruption. But what we did see, and as a matter of fact, I was discussing with a journalist who has been visiting Romania, I guess 1 or 2 years ago, and he interviewed a couple of people in the system, and particularly some people who worked in government in 2016, 2017, to ask what has changed in the Romanian healthcare system after 2015, after the collective fire. And although there are structurally, there are not many things which have changed, the thing that I did mention to them is this collective action, not necessarily directly targeting corruption, but collective action targeting ways to circumvent the involvement of the public sector in addressing key and important issues of the healthcare system. And one of the topics is hospital infrastructure. And what I want to get to is this beautiful example. This is an NGO led by 2 brave ladies. It's called Dăruiește Viața, Give Life. And they have started a wild donation campaigns a couple of years ago. And what they have managed to do is to engage tens of thousands of Romanians and tens or hundreds of companies. And as a matter of fact, I guess they're on the very close to inaugurating an entire hospital, a children's hospital in Bucharest, which has been built exclusively from donations from individuals and from companies. No resources from the public system. Of course, the hospital will be operated by the public system, but what we've seen is that there was this huge energy that was directed to that, as seen of something as a way of in which regular people who are not working in the system or don't have very much to do with the system, they can contribute to some positive action in that direction. With regards to your second part of the question, what the church can do, I believe that there's a lot that the church can do, and of course that varies from church to church and how strong they feel about these topics. But one very specific aspect in which I believe the church can be involved is, for instance, supporting Christian medical groups and Christian student groups to provide them with the necessary support and encouragement in staying with the right level of integrity to be able to not mix with the environment, which is trying to change your behaviors, change your values. Because in Romania, for instance, it is only with the younger generations that people have Christians practicing Christians have access to higher education, and especially in the medical sector. So there are not many opportunities where they can get mentorship opportunities or experiences from others who have gone through something. So I see a great role of church in supporting these initiatives and supporting people who are there at the forefront and confronting these systemic issues in the healthcare system.
Kelly, I believe your hand is up next.
Yeah, thank you very much, Marius. I echo the accolades you're receiving. I very much appreciated your presentation. I found it very helpful, and I will be digging into the resources you mentioned from Transparency International, The Lancet, etc. I also appreciate the fact that you covered healthcare in such a broad area, and then many specific examples from Romania, both of which are broad subjects, but I just thought the broad specificity of the topic and the way you did it was very helpful. A few points and then one question. One, I would just want to flag, being a psychologist, that everything you talk about concerning health also applies to mental health with regards to corruption. There are so many ways to be corrupt and to allow corruption in the broad area of mental health, especially for those who are the most vulnerable and don't have access to mental health care around the world. The one point that you mentioned in general about the complexity of corruption, for example, the sociocultural aspects and how consumers can be involved inadvertently or knowingly. And the quote from The Lancet was just amazing about how individual action or inaction collectively contributes to a massive corruption level and stuff like that. We might think that we're just hardly doing anything, but collectively, all together, it just, we're all in this together. I think it's just not, the bad guys out there. And I also wanted to say that, we've been thinking about what theme should we have for something that we're involved with every year called Global Integrity Day. And this is year 3. The first year was on corruption and racism. The second year, which is this year, was on corruption and poverty. And I think it might be really timely to have the next theme on corruption and health. And we'll be talking about that, and just your material and the way you presented it really stimulated us. Thank you for that. The specific question, or more specific question I have for you has to do with who, broadly speaking, within or without of Romania, do you connect with as a healthcare professional researcher? Where is the momentum? Where is the focal point or points regarding health and corruption right now, would you say? I attend with my wife and others lots of health webinars and things. Corruption is almost never discussed, but who is discussing it, and how can one get more centrally connected with that? Thanks.
Thank you. Thanks so much for the observations, and also thank you for the question. Just to quickly mention that I believe that having corruption in health as a topic for your series of yearly events, I believe that would be great, because that would basically address what we've been discussing here, that we do not talk enough about corruption in the health system. So we need to further dig in this topic. I've been fortunate enough to work with a number of colleagues, and as a matter of fact, that is how I ended up having this presentation, because it was at the invitation of Martin Alabi to have this presentation. As I mentioned, I was fortunate enough to work with a number of colleagues a couple of years ago, and we also had a brief publication. The link and the title are in the presentation, within CMF, and it was a very rich experience, because we discovered that this is a global phenomenon, and even if maybe we're I don't know, tempted to say that, oh yeah, that is Central Eastern Europe, oh yeah, that is I don't know what other region of the world. They come in all sorts of shapes and flavors. So corruption is everywhere. Conflict of interest, because that was the focus of our paper, corruption and conflict of interest. that is omnipresent wherever you go. So that was, and I had the opportunity to also meet with colleagues. Of course, that was before the pandemic. We had a couple of online meetings and a physical meeting in London. I guess that was really great in terms of putting things into perspective. And along the same lines, I'd say that it's so important to keep connected with people who share an interest in this and have a passion to bring a change in that regard. Now, apart from this Christian group, which is CMF Christian Medical Fellowship, there's there's also a small group in the World Health Organization. I briefly got in contact with them, but just before the pandemic, there's a specific group at the headquarters in Geneva working on corruption. And I guess there was a technical group. I don't know whether they really kicked it off because they were started before the pandemic, and I don't know how that impacted it. But slowly, there are bubbles rising from various places, and which is really encouraging. Over.
Just a follow-up comment, if I could say, I think it'd be interesting to keep exploring to see, for example, in some of the major anti-corruption venues and conferences, to what extent health is a focus. For example, the International Anti-Corruption Conference, where Transparency International is the secretariat, what you mentioned with WHO, and even right now in Egypt, what's happening with the the Conference of State Parties to the United Nations Convention Against Corruption. Is there anything related to health in some of these major efforts? So that might be out there, the research, but I'm curious, and we'll want to kind of explore that some more. Thanks again.
I think another contact well worth picking up again would be with Richard Horton, who's editor of The Lancet. So it was Richard, together with the leaders of the Academy of Medical Sciences in the UK, that invited Patricia Garcia, as Peruvian Minister of Health, very concerned about corruption, to give her talk 2 years ago. That was very significant because the selection of topics for that annual lecture is not constrained at all, except that it has to be something in the field of health. It could be about new drugs, it could be about viruses, it could be about HIV/AIDS. They happened to choose corruption in healthcare. And I know that this is a particular concern of Richard, and he was suggesting there perhaps some pressure could be brought to bear on the Wellcome Foundation, which is a well-endowed donor, to fund some research in this area. So definitely worth following that up, I think. Am I allowed to make 3 other brief comments? So the first one is, I've asked myself, what does virtue, what does goodness look like in this? And my experience is that, at least in Christian circles, goodness is conceptualized as be honest. And clearly that has a role, but increasingly, I think at least as strong needs to be the virtue, be brave. Because as anybody who tries to fight corruption rapidly experiences, you find yourself up against a lot of powerful enemies. And Jill Stoltzfus, who is on the call here from ASJ, part of their description of themselves is they are a group of brave Christians. They don't say we're a group of honest Christians, we're a group of brave Christians. So I think courage has to be right up there. The next comment is, I'm always really interested in the relationship between grand corruption and petty corruption. And we've touched on that a bit today. And I hear quite divergent views about how far it's possible to go in tackling grand corruption without simultaneously tackling petty corruption. And I'm not sure we have any good evidence to answer that question, but if anybody knows of any, I'd be really interested to see it. And my final observation is about the strategic choice one makes about whether to try to reform the public sector or move away from it into the private sector. And I was interested, Marius, as your comments that in Romania recently people have sought to establish hospitals which themselves, I think, are outside the public sector. And that contrasts, I think, with the approach that ASJ is taking, which is saying, no, we really, really want to reform the public sector and not in any way give up on it. So a few comments and a couple of questions.
Yes, thank you so much, Martin. That's really interesting, and also, I mean, you touched your last question touched on something really, really delicate, and to be honest, I would have no definitive answer, not even on the Romanian experience with regards to this tension between the public and the private sector, because I've also had the experience of being in the decision-making positions, and when I was a Secretary of State, but even recently this year, I served as an advisor to the Health Minister at the beginning of the year, who has been coincidentally the same minister since 2016, only that now he's a politician. And from April to September, I served as Chief of Staff to the minister who followed after him. And there are no easy answers on that. I believe that, and this is just my personal opinion without any institutional hat in this moment. For even private initiatives to thrive in helping people have better access to high quality services and building equity, you still need to have a great accountability and oversight from the public sector and from the government. Now, what we have in the Romanian healthcare system is really poor administrative capacity, and that is widespread either at the central level and at the local level. So right now, it's difficult to choose what would work best, because also things are quite particular, and you cannot really grasp on evidence about what worked elsewhere. Because trying to consolidate the public system seems to be an attempt which will not be crowned with success, since there are so many problems in the public administration, and you have many public officials who do not have the necessary skills and competencies and capabilities. On the other hand, if you go to the direction of having more or less fully privatized healthcare system, we see from the experience of other health systems that is a huge challenge with regards to ensuring equity and access for everyone, and especially given the fact that many people in Romania lack the adequate levels of health literacy and to focus enough on their health preventive efforts. There are high chances that these people will be left behind. So it's very complex and really challenging. And what I could see in my my mandates at the Ministry of Health is that this is being perpetuated also for the fact that many times the Ministry of Health, with these frequent, I've seen, by the way, I've seen a comment relating to the coalition in 2004. Unfortunately, I guess from 2004, we had like, I don't know, 20 governments or something like that. In total, from 1989, when we escaped communism, until present day, we've had, I guess, 30-something health ministers. So with this level of fragmentation and lack of continuity, it's very difficult to build on something which is sustainable. It's very difficult to bring a long-term perspective, since you do not have the assurance that you can follow up with that. So many times the challenge for any health minister, regardless of how well intentioned they are, is that they need to challenge the urgencies of the moment without having enough time or resources or capabilities in the ministry to look at the systemic things which are preventing the health system to deliver what it should deliver.
Well, thank you all for your questions and your participation in this discussion today. It is now a few minutes past the hour. So before we conclude this tonight's webinar, I would like to talk a little bit about what the Faith and Public Integrity Network is for those of you who are not members of this network. The Faith and Public Integrity Network aims to address corruption by nurturing and developing an enduring global community of Christians who are pursuing public integrity work in their own contexts around the globe. So our focus is on building relational connections among our members, of which about 70% hold positions of leadership in their organizations. We provide a space where our members can connect personally, work towards technical collaboration, and offer personal, spiritual, and professional support in this challenging work. If you are interested in learning more about our network, becoming a member, or participating in other events like this in the future, you can visit our website or sign up for our newsletter or follow us on Facebook. I've put all of that information in the chat just now. You can also reach out to me. Again, my name is Allison and I am the administrator for FPIN and can get you connected to resources and people. This concludes our event for today. Somebody mentioned in the chat earlier that you would like to see you would like to have access to Marius's PowerPoint presentation. So we will a little later put up all of this information on the website, a recording of this webinar, as well as Marius's presentation slides. I will send you all an email once that is ready so that you can view it again and share it with your networks as well. I'd like to thank you all for joining us. Thank you, Marius, again, for sharing with us about your work and your experience with the healthcare sector in Romania. We are very grateful that you, for your willingness to take some of your time to share with us today. And of course, thank you all for your time for the time you've taken to come here and listen and participate. And that concludes our webinar for today. So thank you, and we hope you all have a good rest of your day.